Hi, I'm Dianna Bordewick, MD. I'm a board-certified ophthalmologist specializing in cataract and refractive surgery. The video you're about to see shows a typical day in the life of a patient getting blade-free LASIK. When you arrive at the LASIK facility, the first thing is your eye is numbed with anesthetic drops.
Good,
Nice to see you.
Thank you.
All set to go.
Yep.
This is kind of the worst part because it's just the whole anticipation. But,
Right.
soon you'll be on the other side of the lawn.
I know.
So if you're all set, the girls should have the room set in a few minutes, so we'll get you over there and get this done.
Okay.
All right, I'm
sounds
excited
good.
for you.
Yep. Thank you.
Good. You're welcome. See you shortly.
Yep.
There are two main steps to blade-free LASIK: flap creation and reshaping of the cornea. You will remain awake and comfortable throughout the procedure. The first part of the procedure is to create the flap. For that part, a suction ring is first placed on the eye to firm the cornea and hold the eye steady. You will feel some pressure from the suction, and this is a normal part of the procedure. In addition to that, for many people, their vision fades out. You shouldn't be alarmed by that because, again, this is a normal part of the procedure. Once the ring is secure, you're positioned under the intralace femtosecond laser, and the cornea or surface of the eye is coupled with the laser so that the laser can make an accurate flap. The intralace then applies tiny pulses of laser light, a quadrillionth of a second each. These light rays, which are computer controlled for maximum precision, pass harmlessly through the outer portion of the cornea and form a uniform layer of microscopic bubbles just beneath the surface of the eye. Once creation of the flap is completed, the suction ring is removed and the process is repeated on the other eye. After that, your eyelids and lashes are then prepared with a cleaning solution and a sterile drape is placed across your forehead. The bed swivels and positions you under the excimer laser. This laser will reshape the cornea to correct your vision. Your head is then positioned under the laser and your eyelashes are taped back to keep them free of the surgical field. An instrument called a speculum gently holds your eyelids open during the procedure. The flap, which is about the thickness of a soft contact lens, is then reflected back to expose the corneal bed, and the laser tracking system is activated. The Allegretto laser reshapes the cornea in about 5 to 20 seconds through a series of tiny high-energy pulses, with an accuracy of up to 0.25 microns or 1/4000th of a millimeter. Once the treatment is completed, the flap is smoothed back to its original position, and we allow it to adhere for a few minutes. The flap acts as a natural band-aid and protects the treated tissue during the healing process. A cool burst of air is used to help seal the flap edges, but because the cornea bonds so quickly, no sutures are required. The speculum holding the eyes open and the tape holding back the lashes are then removed, and the procedure is repeated on the other eye. Once completed, antibiotic and anti-inflammatory drops are placed in your eyes and the cornea surface is rechecked. You are sent home with tinted goggles to protect the eye, as well as medicated and lubricating eye drops to use post-operatively. You can expect a few hours of scratchiness, irritation, and blurred vision. Though many patients report seeing the results of the laser eye surgery immediately, you will need someone to drive you home as your eyes will tear, you will be light sensitive, and your vision will be hazy. However, most patients experience about an 80% visual recovery overnight and are able to return to work and resume normal activity the next day. We recommend that patients do not sleep, but to go home and do activities that will allow them to blink normally. Beginning the day after surgery, you will be scheduled to meet either with the doctor performing the surgery or your primary care provider. There are some restrictions following LASIK or refractive surgery, although these are minimal. Most patients can go back to their normal activities within a day, even work. or sporting events. We also recommend that eye makeup should not be used for a week following the surgery. We do have a doctor on call 24 hours a day, every day of the year, if you have any questions or concerns regarding your procedure. It's important to the success of your procedure to use your eye drops as directed. We always prescribe an antibiotic and an anti-inflammatory drop. The antibiotic drop is 4 times a day for 3 to 7 days following the procedure. And the anti-inflammatory drop is also typically 4 times a day for a week. Your eyes may not feel dry after refractive surgery. You may not know that they're dry, but if you're feeling any kind of discomfort or blurred vision, artificial tears are the first thing to reach for.
I'm feeling fantastic. It was really nice to get up this morning and wake up and be able to see. I could see the alarm clock when I woke up. I could see, we have a TV in our room, I could see the cable box with the time on there. And that's a little bit farther away, so that was even more important, I think, because it just, I was like, wow. My eyes feel fantastic. I do not feel like I had surgery yesterday. I feel the care was excellent. I really liked Dr. Bordewick. One thing I really enjoyed, what I really thought was important, was that she was the one who examined my eyes before the surgery, which is something I wanted the person who was going to do the surgery to see my eyes before they did surgery on them. I felt that was important. And she was very friendly, easy to talk to. We have a swimming pool, and I always found it kind of annoying to go in the water and I have my glasses on, or I had to put contacts in, and then you're afraid of losing your contacts, or just noticing now when I would wear my contacts, my eyes would get very dry by the end of the day. I was getting a lot of headaches, so I'm looking forward to not having that issue anymore. I'm pretty active. I exercise, so if I go and run on the treadmill, I don't have my glasses bouncing around or getting sweaty under the eyes. I would say 2 hours later, by that time already, I could see quite a bit better at that point, and I didn't notice any tearing. I was impressed. I was expecting it to be more uncomfortable than what it was. Green Bay Eye Clinic, I felt like they were so professional and friendly, easy to talk to, and just from recommendations, my eye doctor had told me like 5 years ago if I considered doing this, I should come to the Green Bay Eye Clinic. So I'm really glad I did, and I think anybody else that would come here would be really happy.